Hi there, welcome to English Caffe. This is Mamta, and in this vocabulary lesson, we are going to discuss words related to coronavirus. So, I'm going to discuss with you 31 words that you need to know so that you can understand the news correctly. So, first of all, I'll list the words that I'm going to discuss with you, and then we will discuss the words one by one. So, here are the words. Number 1, COVID-19. Number 2, epidemic. Number 3, pandemic. Number 4, isolation. Number 5, quarantine. Number 6, self-quarantine. Number 7, acute respiratory problems. Number 8, contact tracing. Number 9, contagious. Number 10, outbreak. Number 11, contain the outbreak. Number 12, epicenter. Number 13, incubation period. Number 14, patient 0. Number 15, precautionary measures. Number 16, social distancing or physical distancing. Number 17, respiratory droplets. Number 18, stockpiling. Number 19, panic buying. Number 20, stringent. Number 21, lockdown. Number 22, symptom. 23, asymptomatic. 24, community spread. 25, communicable. 26, immunity. 27, immunocompromised. 28, super spreader. 29, ventilator. 30, respirator. 31, screening. The first one is COVID-19. This is what everyone's talking about. So what does COVID-19 mean? COVID stands for corona, V stands for virus, and D stands for disease, and 19 stands for 2019 since the disease started in December 2019 to be precise. So COVID-19 stands for coronavirus disease 2019. That was first word. The next word is epidemic. Epidemic is a contagious disease that spreads very quickly in a particular geographic area within a short period of time. So that's what an epidemic is. Next word is pandemic. A pandemic is a contagious disease that spreads in a large geographic area within a short span of time. For example, COVID-19 is a pandemic in the world right now. The next word that we have is isolation. Isolation means separating the sick people from the people who are not sick. So isolation is the process in which we separate the sick people from the people who are not sick. Quarantine. Quarantine is the process of isolating people who may or may not be sick to prevent spread of the disease. So that's quarantine. Next one is self-quarantine. Self-quarantine is the process in which the people quarantine themselves to stop the spread of a disease. For example, even before the lockdown in our country, many people had already gone in self-quarantine in order to stop the spread of the disease, in order so that they could stop getting the virus or spreading the virus if they had it. So that was self-quarantine. Next one is acute respiratory problems. So respiratory is related to breathing, and acute means a problem. If a problem is an acute problem, that means it worsens within a very short period of time. The problem increases within a very short period of time. So COVID-19 comes with acute respiratory problems. It comes with problems related to breathing that increase very rapidly. So that was acute respiratory problems. Acute means a problem or a disease that increases too quickly. Next one is contact tracing. Contact tracing is very, very important when it comes to contagious diseases, pandemics like COVID-19. Contact tracing means tracing each individual that an infected person has come in contact with. That's what contact tracing is. Our government and many other governments of many nations rely on contact tracing to stop the spread of COVID-19. So that was contact tracing. Next one is contagious. Contagious means a disease that's infectious. So contagious and infectious are synonymous. Next one is outbreak. Outbreak means the sudden spread of a disease within a short span of time. That's what an outbreak is. Like we're talking about the current COVID-19 outbreak in the world. Next one is contain the outbreak. Contain the outbreak means to control the spread of a disease. Next one is epicenter. Epicenter is the place where the disease is most prevalent at the moment. For example, right now USA is the epicenter for COVID-19. Next one is incubation period. Incubation period of a contagious disease is the period between when a person gets the virus and when they start showing the symptoms. So the time period between getting the virus and showing the symptoms is incubation period. Next one is patient zero. Patient zero refers to the first patient who gets the disease. Next one, precautionary measures. Precautionary measures means measures that are taken to avoid the problem. Precautions taken in order to not get the disease at all are precautionary measures. For example, social distancing, washing your hands again and again are some precautionary measures for COVID-19. Next one is social distancing or physical distancing. So social distancing stands for not staying indoors, not meeting many people, whereas what's more important right now is physical distancing. Physical distancing means maintaining distance from other people, maintaining a good amount of physical distance between two people is what physical distancing is. And as the governments have been saying, physical distancing is what will stop the spread of coronavirus. So physical distancing. Next one, respiratory droplets. Respiratory droplets are the small drops that come out of our nose or mouth when we breathe or cough or sneeze. So those are respiratory droplets. As they say, coronavirus is a droplet infection, which means it spreads through the droplets that come out of our nose when we breathe or cough or sneeze. So that was respiratory droplets. Next one is stockpiling. Stockpiling means stocking too many essential goods when there is a scare or a fear that the goods or items might not be available in future, like what we did when the government announced the lockdown. And the other word related to stockpiling is panic buying. Panic buying is sudden buying of essential items like grocery and others, again in the fear that they might not be available in near future or might get costly, etc. So panic buying. Next one is stringent. Stringent means strict. Stringent measures to control COVID-19. Strict. Next one is lockdown. Lockdown is the act of not allowing people to come out of a building. In our case right now in COVID-19, not allowing people to come out of their houses is what lockdown means. Next one is symptom. So symptoms are the problems one gets when they have a disease. For example, the symptoms for coronavirus are high fever and dry cough and respiratory problems. So that's symptoms. Next one is asymptomatic. Asymptomatic is a person who might have the virus but has no symptoms. So there could be no symptoms but you could still have the virus. If that's the case, then you are asymptomatic. Next one is community spread. Community spread of a disease means that the disease spreads even when you've not met somebody who was infected, or even when you have not traveled to a place which is affected by the disease. So if that starts happening, that's called community spread. And the experts say that India hasn't reached that stage yet. We don't have any community spread cases as yet, is what they say. Next one is communicable. Communicable is synonymous with infectious or contagious. So communicable, if a disease is communicable, it spreads from one person to the other person. For example, COVID-19 is a communicable disease. Next one, immunity. Immunity is our body's capacity, internal capacity to fight the bad bacteria or viruses and protect our body. The next one is immunocompromised. An immunocompromised person is a person who has a weak immune system. For example, the older people or the children are immunocompromised. So that's why they are more prone to getting COVID-19, and that's why the experts say that we have to maintain social distancing with children and older people. Most importantly, older people. Next one is super spreader. Super spreader is that one person who spreads the disease to many people. Next one is ventilator. Ventilator is a machine that is used on a patient to give them oxygen. So when somebody has acute respiratory problems, a ventilator is used to supply oxygen to them. Next one is respirator. Respirator is a mask-like device which is used by doctors and other healthcare professionals to protect themselves from the dust or microorganisms like bacteria or virus from entering their mouth or nose. So that is respirator. The last word is screening. Screening means tests that are done to detect a certain problem. For example, many experts say that India is not screening enough people right now. That means we are not testing enough number of people for COVID-19. So that's all for this vocabulary lesson. We discussed 31 words related to coronavirus, and I hope that you have more clarity on different terms and expressions used to talk about coronavirus, and you will be able to understand the news better. Please let me know what you think about this video. Please let me know if you found it helpful, and I would also like to tell you that we've recently started online classes at English Caffe. We are offering group classes as well as one-to-one classes. So if you or someone you know needs help to improve their English or other communication skills, we would be happy to help them. Please call us on our boardline numbers that are there on our website, Facebook, Google. You can find us everywhere. So that's all for today. We'll be back with more lessons. Thank you.